ready? All right. Good morning. Welcome to Asia Society Hong Kong Center. I am Alice Meng, Executive Director of Asia Society Hong Kong Center. It's my great pleasure to host episode 4 of our coronavirus update. We're giving you an update. This has been our 4th week, and we're really excited that this morning here in Hong Kong, it's about 9:30 a.m., and we're bringing you 4 fantastic experts from 3 continents. And I'm going to introduce them right now, and we're going to get to our questions and our dialogue, our discussions right away. I'm delighted to have Professor Keiji Fukuda, Director and Clinical Professor, Community Medicine and Public Health, Practice Division, School of Public Health, University of Hong Kong, here in Hong Kong with me. Professor Nicholas Jewell, Professor of Biostatistics and Statistics, School of Public Health, University of California, Berkeley. Professor Jewell is in California. Professor Arthur Reingold, Division Head of Epidemiology and Biostatistics, School of Public Health, also University of California, Berkeley. And Professor Reingold is also in California right now. And Professor Mr. Jordan Tappero, Deputy Director of Neglected Tropical Diseases, Bill and Melinda Gates Foundation, and Rear Admiral and Assistant Surgeon General, U.S. Public Health Service, retired. And Mr. Tappero is with us from Geneva, 2 a.m. this morning. So delighted to have all 4 of you with us. And we're going to get right started. The purpose of this program has always been to shed light on this topic of COVID-19. And here in Hong Kong, where we have been kind of ahead, we've been living with it very much on and off for the last 2 months. And in fact, a month ago, this is when this program kind of got started. So we're really delighted that today we can give you kind of a global update. So for me right now, it's really my great pleasure to have Professor Tappero give us a kind of an idea of the global development as of today. A lot has happened, and we're going to hand it over to Professor Tappero.
Well, good morning, everyone. At least from where I am, it's early morning. I'm going to be reporting just at a very high level on the numbers of cases reported through WHO as of 6 a.m. yesterday. We don't speak about today's numbers until 6 a.m. Here in Geneva, and that's less than 4 hours away. But as of the 4th at 6 a.m., there were 120 new confirmed cases in China, bringing a total there to 80,422. And then outside of China, there were 2,075 confirmed cases in just the last 24 hours from the 3rd to the 4th. And that's clearly the number of cases that are occurring outside China now dwarfs that are arising in China newly every day. So globally, we have a total of 93,062 cases through 6 a.m. on the 4th. That's 80,422 in China and 12,640 outside of China total. I think what's interesting now is that we have cases that are occurring almost everywhere in the world. Every day there's new countries that seem to be added to the list. Through the 4th, Ukraine, Chile, and Argentina were 3 countries that were newly added to the list. And there are some hot areas around the world by the WHO regions. For example, there are 6 EMRO countries with no cases now. Otherwise, there are cases reported throughout EMRO. That's the Eastern Mediterranean region. In the European region, 35 countries have reported, 27 countries have yet to report cases. And so Europe seems to be an area where there's also rapid increase in the number of cases that are being reported throughout the region. And then there tend to be these clusters of cases that are related to unusual conveyances. I think you're all familiar with a couple of weeks back, the Diamond Princess that pulled into port in Yokohama, Japan, resulting in many hundreds of cases coming off that ship after the completion of quarantine. Then there's also just yesterday a cluster of cases that are linked to a cruise ship that went down the Nile River to Luxor and Aswan in Egypt, that 126 passengers were on that cruise. So there are there's also these special clusters or conveyances that continue to surprise. When we think about confirmed cases that are happening in large numbers, if we look at the Western Pacific region, Republic of Korea is by far the country with the most number of cases, cumulatively over 5,000, 328 as of yesterday. Japan, 287 cases, Singapore, 110. So those are the countries in the WIPRO regions that are most heavily affected. In Europe, it's Italy with 2,502 cases cumulatively through March 4th, and France and Germany are a ways behind with 212 and 196 respectively. I think the Emerald countries, it is the Eastern Mediterranean region countries, the Islamic Republic of Iran reported 2,336 cases through March 4th. And then there are several other countries that are sort of down in the low 50s, down into single digit numbers. So I guess to summarize things up, wouldn't want to forget Pan American Health Organization region. The United States leads the pack there. As of yesterday, there were 108 cases with 6 deaths. I think there's going to be well over 115 reported today. It's wake up time there, Art. I haven't looked at the newspaper this morning. They probably even have the latest figures. So in short, we have a lot of countries that are still very active, having faced exponential growth in the last few weeks, and a lot of new countries that are reporting coronavirus cases for the first time. And it looks like we're in for a long several months ahead of looking at containment or mitigation for coronavirus globally. I'll stop there.
Thank you. Thank you, Professor Tappero, for that really quick summary. And now it's my pleasure to turn over to Professor Fukuda here in Hong Kong to talk about the more recent Hong Kong and Asia development, but also maybe a bit of kind of update. I feel like we've been ahead of the curve with some of the developments, but can you kind of just give us a summary of what you're seeing and what you're paying attention to right now?
Sure. Thanks, Alice. And good morning and good afternoon to everybody. Just to give you a little bit of background, I've spent a fair amount of time in Asia over the last couple of decades on various outbreaks. And so I've spent a lot of time here. So in Hong Kong with bird flu and SARS, and then in mainland China with SARS, and again, H7 and H5 forms of influenza, and then in Korea with the Middle East respiratory virus. And this current COVID-19 situation is similar in some respects to those other outbreaks, and then it's really unique in other respects. I think that also one of the things that being here has made me realize is that in the past, I've always come to these regions as part of CDC or as WHO, and it's a little bit different actually living here in the community. It gives you a much more nuanced feel for what it is like to be in an area which is really quite central to the entire outbreak. And from that vantage point, the other thing which is important for everybody to realize is that the Hong Kong of the past is really different than the Hong Kong now. I mean, it's the city has really evolved in a lot of ways, but I think the important recent developments have been the demonstrations that we've gone through last year, which has set up a social context, which is really quite different, and I think somehow affects the whole response to this outbreak. So if we look at the outbreak itself in Hong Kong, the first cases appeared, I think, in the mid part of January, about January 18th. And it's now been about 6 weeks or 7 weeks since then. And over that time, I think the most recent cases have been about 104 cases. So the Center for Health Protection, which is the control center for the outbreak in the city, has a very nice epidemic curve, and I would encourage all of you to look at it. And if you look at it, you'll see that the cases peaked in the city sometimes at the end of January. So that was the highest count. But what's more interesting to me is that if I look at the cases over the 6 or 7 week period, it averages out somewhere around a little over 2 cases per day. And I often look at that curve and think about these numbers in comparison to what we're seeing in the north of here. So over in Guangdong province and Hubei province and so on. And it's really quite different picture. And also the other thing which I'm personally monitoring very closely is the number of cases who are just in the community, but with no known contact to any other cases. And interestingly, and I think importantly, it's been a fairly sporadic pattern. There are cases which are identified, but there's no overall trend to them. And so I think this is quite encouraging. So based on all of that, and looking at the experience north of here, I think it's probably fair to say that the control efforts by the city have in general been pretty effective. That's my own conclusion. And this is in part working with some of the advisory committees on the government, to the government and so on, and seeing some of those data. Now, one of the aspects which is also important for the audience to understand is that Hong Kong does have a number of assets. It has a number of strengths that some locations may or may not have. But in terms of the foundations, it's quite good here. You know, Hong Kong is one of the communities which really learned after bird flu and after SARS. The public health infrastructure is really geared towards outbreaks. Mm-hmm. The scientific foundation community is as good as it gets. And even the government, which has been quite heavily criticized by many in the public, you know, it has the chief executive and all of the secretaries very attentive. And so they're paying attention to what's going on a day-to-day basis. The city itself has used a combination of strategies. It's tried to reduce travel into the city from infected areas. This has been done by selective border closures, by making it more difficult for some travelers to come in, and by employing quarantine for other travelers coming in. It's also very heavily promoted social distancing, and this has been quite profound. So government workers, people working in business, schools have been closed, recreational activities have been largely postponed, and you really see that in the city. On the personal front, again, messaging has been quite important about staying home if you're sick, using face masks in certain situations, washing your hands has been very heavily promoted. And I think these measures have been particularly effective here because the population really remembers SARS. You can hear people talking a lot about this, and so you begin to see how the social awareness in this community is very strong. There have been a number of vulnerabilities also. I think the demonstrations has shaken the public's confidence in the government. And this has clearly made it more difficult for communications to take place. And I think that this is a constant struggle. And I think one of the manifestations of this has been, for example, that healthcare workers did go on strike for a while. And again, the negotiations between the healthcare workers and the government did not go that well. Other vulnerabilities I see are that the supplies of personal protective equipment like masks are in short supply. And so there's a constant worry about that. There are, like everywhere in the world, a lot of rumors going on. And so these have led to runs on paper products. It's made it very hard to get things like hand sanitizers. And then there has been a difficulty just getting quarantine space. You know, there has been a want to bring back people from Hubei province, for example. It's simply where to put them. It's been difficult. And again, in one of the locations, there have been fires set simply to protest setting them up as quarantine centers. And so all of these I see as vulnerabilities for the city. Nonetheless, given all of that, I think the control has been good. But I think one of the important points is that as the outbreak escalates worldwide, we are still vulnerable if there's a big surge in cases. I think the overwhelming on any of the systems can get overwhelmed. So I think the last issue right now for the city, or the big issue for the city, is how does it begin to normalize? And I think that bringing people back to work, back to school in some kind of stepwise way, but monitoring to make sure there isn't an explosion of cases is really the challenge in front of the city now. Alice, let me stop there.
Great. I think your Professor Fukuda's complacency, I think, is a good way for us to remember, because we're not out of the woods yet. Even though on my way to work this morning, there's actually traffic now. So it's kind of signs like Professor Fukuda, things are getting slowly back to normal. But I don't think there is going to be a normal here in Hong Kong or anywhere in the world because of this COVID-19. So for that, and I'm as a Chinese American, I have family in the States, and they were really my brother who lives in DC in early January or mid-January when the virus started, sent me a lot of masks, and they've all arrived. And now I have a feeling I may have to be sending masks back to the States because of what's happening in the United States right now. So I'm going to turn over to Professor Reingold to tell us the situation, give us an update on the situation in the United States. Originally, I think in the few weeks ago, I think they weren't paying that much attention, but I think they are now. So Professor Reingold, can you give us a kind of an update as a current situation in the United States right now?
So first of all, thank you very much for inviting me, and good morning to everyone there. I should note I was in Hong Kong during the SARS outbreak. I won't go into details about why that was, but I experienced Hong Kong my first time in the midst of the SARS crisis. So I can readily appreciate some of the anxieties that might be there now. Jordan has already said a little bit about the situation in the United States, and I think since we want to conserve a lot of time for questions, I'll keep my remarks relatively brief. As Jordan said, we have something a little in excess of 100 confirmed cases in the United States at the moment, but probably that's already the wrong number. And so it's a moving target. As of today, I know of 11 deaths in the United States, or 11 or 12. And as many of you may know, that the vast majority of the cases in the United States are in California. And although we certainly have cases in Florida, we have a case now in New York City, we have a very troubling problem near Seattle, north of here, which I'll get back to in a minute. So, and we have cases being confirmed, currently confirmed in at least 13 states in the United States. So I think it's pretty clear the virus is here, and that the more testing we do, which we will be doing, we will find more cases. And we certainly have individuals who have acquired the infection without ever leaving the United States and who don't appear to have a connection to somebody who had recently come into the United States. So that would suggest we have community transmission of the virus here, but that's certainly an area of active investigation. I want to just point to the tragedy with this nursing home up in the state of Washington, and it makes it very clear that this is a virus we don't want in nursing homes, and we don't want in individuals who have, elderly people with underlying conditions, because they're obviously quite vulnerable to severe illness and death with this virus. Everyone who reads the newspapers will know, you alluded to the fact that some people didn't seem to be taking this problem very seriously in the United States a few weeks ago. I think epidemiologists were, public health people were, but perhaps not all of our political leaders were. And that appears to have changed in the last week or so. And there will be a major appropriation from Congress to substantially ramp up the response. So that's good news, if a little belated. I would say that that's going to clearly lead to greatly enhanced testing for reasons that I won't go into. Up until a week or so ago, the United States had tested a total of around 450 people. And as opposed to the thousands or tens of thousands tested in South Korea, for example, or elsewhere. So we expect the test now is pretty much available in all state health departments, private labs, university labs, hospitals are developing their own tests. And we're about to have a lot of testing. And with testing, we will undoubtedly find more infections. There are a number of projects getting set up to build on influenza surveillance so that we'll be routinely testing people who are tested for flu but are negative for flu as a way of quickly determining whether there are a lot more cases of respiratory infection or pneumonia caused by this virus in the United States, and those data will be coming out in the weeks to come. I just want to say two other points that I've been immersed in quite a bit the last few weeks, which is that, as I'm sure people on the call or listening in often are involved in large organizations, making complicated contingency plans around travel, around business meetings, a host of other things. We have a university of around 45 or 50,000 students and staff and faculty, and we have daily calls or meetings to try and figure out what we will do if we have to close the university, if we have to move completely to education without classrooms, how we will isolate or quarantine large numbers of people, how we'll feed people, what to do about people arriving here or coming back here. So this is an enormously complex task. We now have had a confirmed case in the city of Berkeley, so it's probably only a matter of time before we do have one or more cases on the campus. But any large organization or business clearly is having to make a lot of difficult decisions about travel, about work types of situations. And of course, this is having a huge impact on economics and on business and profits and that sort of thing. So many of those groups are looking to epidemiologists for help. And maybe Nick will be able to answer the questions that they have about where is this going? How big will this get, particularly in a country like the United States or the UK, where many of these people are calling from? Are we going to have a few thousand deaths in the United States, 100,000 deaths in the United States? Will we be paralyzed? And I frankly don't know the answers to those questions, but maybe Nick can help us with some of his modeling. So I'll stop there, and hopefully there'll be some good questions and conversation.
Great, thank you. Thank you, Professor Reingold.
Oh, I should say one more thing. Sorry, it may not be in the news yet, but we have another cruise ship, the Grand Princess, and apparently the first death from SARS here in California apparently was on that cruise ship on its last cruise. And there may be a second case in someone who was on that cruise ship. That cruise ship currently is scheduled to dock in San Francisco tomorrow with a total passenger and crew of 5,000 people. And there may be some ill people on that cruise now. So I imagine my public health colleagues are rather busy tonight figuring out exactly what they're going to do with that ship.
All right, I think the stories continue there. We're going to monitor that situation. There goes, originally Family Christmas this year, we were in California, and next year's cruise was going to be on our list, but I think cruise is going to be out for a while. As my parents are in their 80s, and I think they will not be going on a cruise for a long, long time. But right now, I think one of the things that I'm really delighted to, we're going to turn over to Professor Jewell to talk about data modeling, projections, and predictions. I find times like this, I know we've been going through up and down of information, fake news, and this is one of the reasons this program, we've decided to bring it to the audience online because we were inundated, I think about a month ago, with so many, I think, false news and the nervousness. And we also, because of social distancing, most of our program here at Asia Society Hong Kong were closed anyway. So I think it's times like this is facts, and I'd like to know numbers and also projections. And that's why I'm really delighted Professor Jewell will be talking about. Can you kind of give us some idea about what you're looking at? And one question I think is on a lot of people's mind is, when do you think COVID-19 will peak in the rest of the world? Professor Jewell?
Yes, good morning. Thank you very much for the invitation. I should say that even though I'm in California at the moment, I'm really based in London now at the London School of Hygiene and Tropical Medicine. And so I'm working more closely with some terrific modeling colleagues there and at Imperial College in London. They're focusing very much on the use of mathematical infectious disease models to provide insight and understanding as to what's actually happening, trying to answer some of the questions you posed just there. It's important, I think, to note, and again, I want to get to questions, so I won't say a lot, and I won't say anything mathematical, but I think it's important to note that mathematical models at this point are largely useful for giving a very broad sense of what will happen, what kind of growth we might see, what kind of growth have we seen, what will that mean for other areas where the epidemic is just starting. Mathematical models at this point are not terribly useful to elucidate the natural history of the disease beyond very simple descriptors, because there are so many models that fit what data we have equally well, but have rather different explanations. So the main advantage and the main purpose of a lot of the modeling efforts at the London School have been to try and quantify and assess the impact of various intervention or mitigation strategies. An example of that might be how effective, given the basic dynamics of this virus spread, how effective will contact tracing be? And to give you an example, for it to be really effective, given what we understand, you probably need to trace and isolate 80% of an individual's contacts to have an 80% chance of stopping growth. And that's a fairly challenging target. It may have been achieved by Hong Kong and Singapore, but many places, many countries clearly will not achieve that goal. Having said that, I think we're very much now 2 or 3 months into the epidemic at a different phase for modeling, where a lot of the effort now is trying not to understand so much the spread, because we're seeing data. The data is, I should say, very limited and of limited quality, because we're relying on national reported figures of the kind that Jordan was talking about. And there are lots of reporting delays, changes in definitions that impact the quality of the data. But I think the main focus right now is trying to model the demands on the healthcare system so that healthcare professionals can prepare and try and understand what needs we will need to take care of people who do get sick. Fortunately, not everyone needs to be hospitalized. Only somewhere between 15 to 20% of patients appear to be hospitalized, but that's still a very large number given the scale of this epidemic.
Okay, great. Thank you, Professor Jewell, on that. And I'm now going to turn the question to, I think, one of you, talk about the COVID-19. It's already affecting the world, the whole world. Why is, this is a question coming from our online audience on Sligo. Why does WHO still not yet announce it as a pandemic? And I was wondering if one of you can take on that. Is it, who would like to take that one on?
This is Jordan. I'll just say a few words. You know, I really think the use of the word pandemic in how it causes so much hysteria is probably one reason. I think what countries have to face now around the world is that coronavirus is, likely going to reach every shore. And what we need to do is do what we can to contain infection. It slows down the speed with which the virus moves through the community, limits the number of people who are exposed, and keeps the healthcare infrastructure from being overwhelmed if it can be spread out over time. The dissemination of coronavirus into new communities. And I think we also have to think about simultaneously mitigation efforts to ensure that when the virus does spread throughout communities, there is preparedness for dealing with it as it touches your community. Art just touched on several examples of that. Keiji talked about how in Hong Kong, the community there dealt with that. And so I think, by and large, the issue is, not wanting the international community or communities to give up with containment efforts by saying that there is a global pandemic. I think the reality is that coronavirus is spreading globally, and I think everyone can see that.
Jordan, while you're on the subject, yesterday a friend sent me an article this is from the New England Journal of Medicine. This is Bill Gates writing about responding to COVID-19, and he asked a once-in-a-lifetime pandemic ? And what I found interesting in the article was the talk about the low and the middle income countries. And so far, what we're talking about with COVID-19, it's been here, China, Hong Kong, and then now Italy, Iran, Korea. It hasn't really hit the LMIC countries. So do you think were we prepare for that? I mean, Hong Kong, regardless of the criticism of the government, the infrastructure, the healthcare, public health infrastructure is there. So are you at all, in fact, this question to all four of you in many ways, are you looking at the LMIC? I mean, it seems to me I'm looking at this as a wave. We see it first here because we're the epicenter, it started in Hubei. But are we going to see this rolling? And now we're seeing it in the United States and Europe. And so will it hit? I mean, when? So I guess the question I have is really related to what Bill Gates wrote about in this article for a March 2nd article. So Jordan, can I ask you to start on that?
Yeah, I'd be happy to say a few things. The Gates Foundation very, very early on in this process, put out, I think first even over almost any government outside of China, monies towards control. It was 5 million, a small gesture, but a meaningful one to China, and then 5 million to begin preparedness, predominantly for Africa. And then a few weeks later, that grew into an additional $100 million. And nearly half of those monies are targeting preparedness activities for predominantly sub-Saharan Africa. And I think, we have seen to date cases now that have been reported in Egypt, as well as the first case reported in Nigeria just a few days back. I think one of the challenges has been not only for countries that are high income and wealthy, like the United States, difficulties in getting testing kit out to its public health infrastructure. And it's also been a challenge for the WHO and CDC and others that have diagnostic test kits to get them, into communities throughout sub-Saharan Africa, to get the training completed and to begin testing. There has now been some testing at points of entry throughout Africa, and a lot of ongoing training is happening now, both by the African Regional Office, or AFRA, out of Brazzaville, as well as by the Africa Centers for Disease Control and Prevention. So a lot of laboratory training to expand testing throughout the continent. My own personal theory is the reason we haven't seen at points of entry very many positive case reports throughout sub-Saharan Africa is that there's very limited testing that's happened to date. And those that have been tested have been selected based on their history of travel, but that it's going to be a struggle in several countries in sub-Saharan Africa. But we're hoping that the lead up to with slowing spread of the virus around the world is going to give sub-Saharan Africa enough time to be better prepared for it.
Could I ask Keiji a question that relates to that? Some people may know there was a paper published a couple weeks ago suggesting, based on air travel patterns, that we're not seeing as many cases as we should be seeing in countries like Indonesia. So I'm just wondering if Keiji has any thoughts about particularly the low and middle income countries in the Asian region, whether there's adequate testing going on?
Yeah, no, thanks, Art. Maybe to build a little bit on what Jordan was saying, I think that it's clear that air travel is the predominant way which we see things spread out. To some extent, what we're seeing reflects air travel patterns. I mean, this has been mapped out for influenza and so on, and traffic is not equal to all parts of the world. But I think it's also clear that in different countries in Asia, the breadth of testing capacities is wildly different, very, very different. And so I think that whether we're talking about sub-Saharan Africa or some parts of Asia or other parts of the world, there's a combination of travel and not as much testing going on. I think that if we had greater testing capacity in other countries, we would be seeing different numbers than what we're seeing right now.
Related to that, Keiji, Chinese New Year was January 25th. And you know, I think Jordan mentioned, you know, January 23rd, the Chinese, the Wuhan, the government put a stop on kind of a quarantine Wuhan. But also another interesting, because I think there are a lot of Chinese investment in Africa. So I think, but with the Chinese New Year holidays, you know, many people are going back to their home. So I wonder if that has something to do with it. But also, I think another concern has been that, you know, tourism, Chinese tourists. So I right now, this fear, I mean, of I guess in many ways, what I'm asking is kind of this impact of travel. Right now, Easter's, people are just not going to be traveling for a long time, fear of traveling on the plane, being confined space. But, you know, is that going to, is this COVID-19 going to change our traveling habits quite a bit here, especially in this part of the world in Asia?
Well, I think, you know, this gets to become very interesting. I think as we begin to tease out the epidemiology and the impact, lasting impact on countries, it's going to get very interesting. I think if we look at the data from China, one of the most interesting epidemiologic features is that familial clustering is so strong. So a lot of the cases are accounted for by families getting together, which is not exactly what we would see with influenza. We would see that clustering, but we would also see more transmission occurring in other places. So we have a strong connection between China and Africa, but whether that kind of contact among people and the populations is the same as we see within China, you know, is a good question, and something that will increasingly get teased out, I think, over time. But in terms of the lasting impact, I'm not sure. On the one hand, there's a very, very strong push for globalization, of which travel is just one part of that and so on. And it's very hard to see this outbreak changing that. I think that the pressures and the forces pushing for globalization are simply too strong. However, even though SARS took place many years ago, even in Hong Kong, I see how close that experience is to what's going on now. And so I do think that it's possible for the airline industry, for government and so on, to take a look at how air travel is being handled. And it may be that we see some different patterns.
I think right now I want to turn over. I think a lot of the question that we have is really about vaccine. You know, right now, and also recovery. That's another question. One of my colleagues asked me yesterday. We've been focusing so much on the, you know, the incident, you know, but the recovery rate has been quite high, has it not? I mean, so it is the spread is easily spread. But can we talk about also the vaccine? I'm wondering if one of you can talk about kind of how long ahead can we look for a vaccine? There seems to be a lot of trial drugs, a lot of collaboration going on with pharmaceutical companies and so on. So can I ask one of you to talk about that, or any of you want to chip in to talk about the vaccine and how long do we have to look forward to in finding some sort of solution? I feel like their fear of is still there. Can you give us some hope?
Well, I'm sure Jordan or Keiji know more than I do, but I was on a call last week with a number of the major manufacturers, vaccines, diagnostics, treatments. And I think anyone who listens to the news will know that the experts are basically saying that Yes, we have some materials that can be injected into people soon, and maybe in the next few weeks even. But even at breakneck speed that's never been seen before for vaccine development, it's hard to envision having large quantities of a vaccine that we are pretty sure is safe and at least immunogenic, making antibodies in people for at least 12 months. I don't know if Jordan has a better estimate on that. I think people often say 12 to 18 months, but Jordan or Keiji, do you know?
Art, I think you're spot on, and I think people like Tony Fauci have been in the media saying the same thing. At the very front end, the best we could expect would be that vaccine would have an answer about whether it's safe and whether it's efficacious in a year, and probably more like a year and a half. And then the challenge will be how much can be produced up to scale for commercialization, and where do those first doses go if we are fortunate enough to identify an efficacious and safe product. And I think the issue around safety is one that our political leaders really needed hammered home. That we have many examples of vaccines that actually have caused harm. Immune enhancement is a real possibility with any new vaccine. This is a new virus. We don't have experience with it, and so the first trials are going to be, in humans looking at safety even before efficacy, are going to be, extremely careful and methodical about making sure that the vaccine first does no harm before it goes to larger studies that can give us an answer about its efficacy. There are a number of vaccine candidates being looked at. I've been over the last 5 weeks with the WHO epidemiology unit, but as you touched on earlier, there is mention in Bill Gates's article about a number of different efforts underway to look at vaccines through industry. And then the National Institutes of Health and its network of partners are also looking, as are many countries around the world.
Alice, if I can add a couple other
Please.
points. In 2009, we had an influenza pandemic, and I think vaccines were the single most complex operational issue there was. And right now we're talking about, can we make vaccine? And we can make a vaccine, and it will take 12 to 18 months likely to have something which is licensed. That's really just the beginning of the issue. I think one of the things that we've seen is that when levels of fear are high enough, for example, face masks can get embargoed, and they can be taken over by governments and so on. And it's always been speculated whether vaccines and so on would be handled in the same way. And I'm afraid to say that, but I think the answer is fairly clear, that in a high enough fear situation, even if you have a vaccine, whether it can get exported from the country where it's manufactured to the other countries is not a given. The second issue, which is a problem, is that vaccines may need cold chain. And if we're talking about getting vaccine to developing countries, a lot of the developing countries in 2009 simply did not have the operational capacity to handle the vaccine. And so trying to develop that was another big issue. And the third big issue was liability. If you have a new product, who's going to pick up liability? And so that combination of issues lies on top of just the R&D and the manufacturing of the vaccines and coming up with adequate supply. So it's really quite a complex issue.
But it's interesting because I feel like this is COVID-19 is spreading. I think virus knows no border, but when it comes to some of solutions, this is when the borders comes in. And in terms, I think in the article in the New England Journal of Medicine, Bill Gates also talked about this. It is really, and I think Keiji, you talked about it. It is the countries, borders, and also, and one of the questions I think for those of you in the United States, I was going to ask you. Now that Super Tuesday is over, and politically, how is COVID-19 going to play in, maybe it will help to kind of targeting to finding some sort of solution in terms of vaccine in the United States, a race to the vaccines of some sort, because this is March right now, and I think the U.S. election season is coming up. So do you all see this playing up in, maybe it's too early to tell, but since it seems to me the election cycle, will that play into this COVID-19?
So I would guess that there's enormous pressure now at the highest levels of the US government to show progress and to come up with a vaccine or to do other things politically. So whether that will speed the process or not, I don't know, but I think the resources will be there. I had a slightly different question for Keiji and for Jordan, which is, I think a lot of people think about, well, international corporations or NIH will develop this, but do you think China could basically decide, we can do this quickly, and we're going to develop and start giving large numbers of doses to people in China in a much shorter time frame because they'll be willing to expedite things, shall we say? Do you think that's a possibility?
Yeah, no, I think just to jump in, Art, definitely. I think that in 2009, I believe China was the first country to develop a usable vaccine. And I think that, virtually all countries and certainly companies with the capacity are looking at making vaccine right now. One of them. So quite possible.
I'm going to turn over Professor Jewell, asking you, what are some of the numbers that you are looking at that will kind of see the end of this virus? I mean, is there certain things that you are paying attention to? Or right now, I kind of get the sense we're not peaking yet globally for COVID-19. But what are some of the things that you think for us laymen, what are some of the things we should also be paying attention to? I feel like in Hong Kong, the numbers are coming down. We're kind of get the sense we're back to normal, but I worry that because people going back to work in China after Chinese New Year, what are some of the numbers that you are particularly concerned about, or you're going to be looking at?
Well, we certainly want to look at the kind of case counts that Jordan was speaking. I look at them daily by country and by region. Quite different phenomenon in different parts of China. Hubei clearly did not put a lid on the spread until it was far too late in the sense of controlling things. And so case numbers increased exponentially very quickly compared to even Guangdong or other Hunan and other areas of China, Beijing and Shanghai. The numbers are still large, but very modest by Hubei standards. So clearly, some of the efforts that were put in place did in fact slow the epidemic. I wouldn't want to say it's peaked in China because it can very easily come back, and they're still reporting hundreds of cases or more than 100 today. On the other hand, in Europe and in Korea and Iran, it's not that dissimilar in terms of how quickly the case counts are doubling. It's not that dissimilar from the early days in Hubei. So even with the forewarning that these countries had and the looking for the virus initially, there wasn't really success in stopping its growth patterns very fast. Very different in Singapore and Hong Kong, as you pointed out, where there was some growth at the beginning, but it's been fairly well decelerated. So that's the kind of things we're looking at. I think in the countries I'm most familiar with, in the UK and the USA, I think we're far from the peak. I think things are going to get much worse before they get better. I'd be interested to hear Art's reaction, but I think there's going to be some fairly severe disruptions needed to try and bring the rate of growth down again. Italy is trying. Today they've closed all schools, even preschools, grade schools, high schools, colleges, all of them in Italy are closed. All soccer games are now being played with no spectators. All theaters and cinemas in Italy will be closed for at least a few weeks. So that's a fairly high level of disruption. And I think we probably are facing that to try and get some sense of slowing the rate of growth, because that's so important for managing the demands on the healthcare system. Complicated enough in the UK with a national health service, but made even more complex in the US by a dispersed healthcare system that's not under federal control. Art, do you have any more take on that than I?
I don't. I was actually pushed fairly hard on this question earlier today about, well, how big will the outbreak be in the United States? Will 70% of the population be infected? And if so, then, you know, do the math and figure out how many people will be sick, how many hospitalized, how many die. And if I don't think it's going to be 70%, then why don't I think it's going to be 70%? And what could we do to make sure it doesn't get to that common an infection? And I didn't have very good answers, frankly.
Well, I don't think we do have an answer yet. It's clearly, in my view, hopeful that it will not get to that scale in China, in part because of the very radical measures of quarantining and social restrictions. That's going to be harder to achieve in countries like Italy and Iran and elsewhere. It very well could be a sizable fraction of the population. I don't think we know yet, because we haven't seen as yet in most countries the reaction as the epidemic really starts to pick up speed. And that will tell a lot as to how seriously governments are taking it in terms of trying to stop things before it gets out of control.
Jordan?
I mean, we really don't have a handle yet on what proportion of a affected community, after you start seeing high numbers of cases like in Italy or what we saw in Wuhan or Singapore, what proportion of the community is infected without symptoms or with mild symptoms. There are purportedly a number of serologic assays that are now being looked at. I'm aware of a couple that are looked at in China. We don't really have published sensitivity and specificity on those tests. We don't know whether those serologic assays are going to be specific enough for this coronavirus and not cross-reactive with the other 4 known coronaviruses that cause the common cold. And so there's a lot of work that's going to have to be done to shore up what we'll learn about what proportion of communities are infected. Keiji touched on that family clustering was found by investigators in mainland China to be responsible for the vast number of clusters and to be the driving force, and that there wasn't as much transmission relative to family clustering that explained other high attack rates. I do think that there is interesting evidence in adults and children that show that the virus, when someone is infected, has shedding of the virus, at least as detected by PCR, not necessarily culture. What that means is not you can't definitely hang your hat on finding PCR that someone is still infectious, but that you're peaking at early in the course of infection, but you can still have evidence of viral shedding, or at least dead virus in secretions, including stool. And we don't know yet. It is said that oral fecal transmission was not observed to be a big problem in mainland China, but it doesn't mean that it doesn't happen at all. And I think the other thing about children is, closing schools, does that make sense? It appears that severity of illness in young children is much lower than severity of illness, in the elderly. And so what we don't know is that if young children, even if they're asymptomatic or have very mild illness, if they can also, because they also shed virus like adults, if they're also capable of being a nidus in a household for causing a transmission to ramp through a household. I think what we've heard from China, from mainland China, is evidence doesn't suggest that that's a problem, but I think that a lot of work needs to be done to understand that role and why young children, appear to be to have infections that are less severe. But do we know what their role is in transmission when children are infected, and what proportion of children actually, are infected, what proportion of entire communities are infected when it's finally resulting in either chains of transmission that are well described, or where there's community transmission and it's clear that not all links or chains can be identified.
This question from the online, the mortality rate of COVID-19 is around 2 to 3% in Hubei and less than 0.5% outside. This implies a majority of people recovers. So can we just treat this like a flu? And this is one. Is that too simplistic?
Well, the case fatality rate is interesting. It's to pick up on Jordan's point, there's two concepts here. The case fatality rate, which is the fraction of deaths you see in people presenting with symptoms, and then the fraction of deaths you see in people who are infected. And as Jordan has pointed out, we don't really know the difference yet in the numbers of people infected versus the number who develop symptoms that require healthcare. And we won't really know that until we have good serological testing. Many people have, the consensus seems to be that the case fatality rate is hovering around 1 to 2%, which is still far more serious than a normal flu season. It may even get higher than that. It depends, because there's still an awful lot of people under healthcare who've got sick who we don't know if they'll fully recover or not. So it varies enormously by age. And it may even, today I was reading, it may even vary by strain of the virus. So it's a little bit, we need to move a little bit beyond a gross sort of 1% or 2% case fatality rate to understanding and explaining to people how much higher it is for the elderly and people suffering with other health conditions. It can be up to 16 to 20% in those very elderly groups. And we need to be strategizing, not just talking about 1% and saying, well, it's not that, it's only about 10 times worse than the flu. It's an awful lot worse for a subgroup of the population. And we need to be strategically thinking about how to protect them more than we are doing so far by focusing on that average number.
One other question I wanted to have, can I give to Keiji? Yesterday, SCMP reported that right now they're studying COVID-19. There's 2 strains. Can you talk about I don't know if you know the COVID-19 has 2 strains of, maybe it's something that we.
No, I actually don't know much about the 2 strains, but, we do expect, given the RNA viruses, over time, we expect them to diversify into a number of different strains. So this is not unexpected.
I think we're getting close to closing. So I want to give this opportunity to give each of you a few minutes to kind of give us your thoughts, kind of give us some your last minute ideas and recommendations. In fact, one of the questions wanted to ask the expert, how should we kind of keep ourselves safe before a vaccine is found? So I wonder if each of you can give us a minute or two of your reflections.
Well, why don't I start? First of all, of course, in terms of keeping yourself safe, we do think that some of the pretty standard boring messages about hand washing, covering your cough, staying home when you're sick, these things are important to do. And Keiji already pointed to the fact that with social cohesion in Hong Kong, there's probably, a much better use of those in the population than we might currently have in the United States. So promoting these messages and the social cohesion that might help with that, I think, is important in terms of individuals. I spend about half my day answering emails from friends and colleagues, whether they should fly to Boston or go to a meeting in Chicago or whatever. And I think people do need to think about, their travel needs. I'm still traveling, but I think, people couldn't often get by without a trip, perhaps. I think the other message is that at least in the United States, we need to be smarter and more mature about investments in our healthcare and particularly our public health system going forward, so that we're not having to respond urgently with a huge infusion of money that's then there for a few years and disappears. Jordan is too modest to say it, but when he was at CDC, he was in charge of a program called Global Health Security, which was attempting to increase lab and surveillance capacity in low and middle income countries. And that was, a reasonable effort that was then canceled by my government and not renewed. So I think continuity of effort and convincing people that these are important functions to support is another important message.
Jordan, can I?
Yeah, I think Art touched on the importance of hand washing, is really important, and not just a quick hand washing, but a hand washing, with soaping up for a good, 20, 30 seconds, making sure you get under your fingernails and get the backs of your hands, and carry hand gel that's at least 60% alcohol, cover your mouth when coughing, and try to be cognizant. It's very hard. I've been trying to do this myself. Try to be cognizant of how often you touch your face and rub your eyes, and try to really practice as a routine now, limiting those interactions. Think twice about the handshake. Maybe, use the Asian Y or the old Ebola elbow bump at most, and limit those physical contact interactions. And I think social distancing around schools and in the workplace, we're starting to see that being widely discussed throughout the United States, if not practiced. At the Gates Foundation, we've sort of canceled non-essential travel for the month of March to see where this goes, and limited the number of convenings that happen inside the foundation, and make sure that we try to do our business either through video teleconferencing or in small numbers at the foundation. I think it's going to be very interesting times, to say the least. What's going to happen in the developing world, and I think in lower and middle income countries, we're really in uncharted territories about what we're going to see there, and how the resources are going to be shared and made available to the most vulnerable.
Professor Jewell?
Yeah, I don't have a lot to add, just to emphasize the same message about personal hygiene. I think it's important. I want to just say two things really briefly. One is, it's not going to be business as usual. There's a great temptation as humans to think this will go away quickly. I think we have to dig in and prepare ourselves for not business as usual for some time. And I don't think we should also completely depend on the government to sort it or to fix it. The government will play, in every country, will play a very important role. But I think every individual needs to take a personal responsibility and talk to their family, talk to their children, make decisions about social distancing, and accept that that's just going to have to happen for several months until we are able to conquer that. We're going to have to be working together as communities in that way, and we're going to have to be kind to each other and take care of those who are most vulnerable.
Thank you, Professor Jewell. I'm going to last word to Keiji, who's here, and you've been living here in Hong Kong, like you said, for the last 3 or 4 years. And it is really different living in the middle of it. I was not here doing SARS 17 years ago, but it was at that 17 years ago, we had a conference in New York, and half the speaker could not come, and the other half the speaker cannot go to Asia. That was when we put together one of the best program. And I remember, and it was on coronavirus. We had Professor Alice Wong from Caltech, David Ho, and we had Elizabeth Rosenthal from New York Times, who had just arrived back from Beijing at the time. So for me, it's opportunity like this that we can have this kind of dialogue, but it is very different living in the middle of it. But we've learned a lot, as you said, Keiji, from SARS. But your last word from Hong Kong, how are you, your advice, because we're really still living through it, even though I feel we're coming out of it, but are we?
Well, I think that this is a nice segue. What Art and Jordan and Nick have been talking about in part is how do we keep ourselves physically safe. Being here in Hong Kong, one of the things I've concentrated most upon is we have a paradox of promoting social distancing. At the same time, we need to be building social cohesion. I tell people go out for walks, get exercise, get out of your house as much as you can. But also there are other ways to build communities. You need to maintain social contact with your friends and so on. Emotionally, it is so important. And because I think I see the impact again of the demonstrations and the outbreak just on the emotions of people in the city. And this is something that I fear the most about the outbreak. The second thing though is outbreaks do help people to do wonderful things, and they're magnanimous in many ways, and it also allows us to do really ugly things. And I see the impact of xenophobia, I see the impact of racism rising up, and I see it becomes very easy to stigmatize groups. It's not fighting the disease, but it shifts over to stigmatizing groups. And I think that just to be aware of that and to really fight that, I think it's incumbent upon all of us to really take the opportunity to point out we're not fighting groups of people. We are really, in the same boat. And I think as we get into this broader international spread, countries are going to be in the position of both excluding people, but then also understanding what it feels like to be excluded from other countries and so on. So anyways, I think that this is one of the enduring realities of large outbreaks like this, and I hope we can make headway in both.
Thank you, Professor Fukuda. I think this is an area where Asian Society Hong Kong and Asian Society at large will be exploring more on this topic. We've already been working on this question of the xenophobia, and I think the discrimination, I think Professor Fukuda really touched upon it. So stay tuned for Asia Society, and we also will be doing a podcast, I think on the mental health. I think for some of us who've been kind of grounded for this last couple of months, and really no concerts, no no theaters and so on. For some of us, it really is a kind of almost like a trap. So this is an area where we will be talking to mental health professionals on our podcasts and our webcasts, because it's, even though like you said, we still need to build this kind of social cohesion. It's times like this, we need to talk more than ever. So on that note, I want to thank all four of our experts taking time from their busy schedule early in the morning or in the afternoon. Thank you all for being with us. And I look forward to welcoming any of you here when the time comes, when you can travel again. Asia Society Hong Kong will always be here to welcome you. And thank you, our audience, for taking part and for your great questions. Good morning. Thank you.
Thank you.
Glad to be with you.
Bye-bye.
Thank you.
Yeah, very nice.
Yeah.